It is a delicate and painful issue that many Canadians are forced to face, putting a loved one in long-term care. Now, this morning, we want to have a conversation about it in the wake of the damning report in Ontario into the case of Elizabeth Wettlaufer, the nurse who murdered 8 seniors in her care with lethal insulin doses between 2007 and 2016. A public inquiry has made 91 recommendations for improving the province's nursing home system. Among the key ones, increasing the number of registered nurses, creating better awareness of patients being subjected to possible harm, and improved storage and control of medications. The Ontario government has pledged to act on those recommendations. For more on this and to answer your questions, we've assembled a panel of experts on the topic. Laura Tamblin-Watts was formerly with the Canadian Association of Retired Persons. She's now a fellow at the University of Toronto's Institute for Life Course and Aging. She's in Sandy Cove, Nova Scotia this morning. Good morning, and thank you for joining us.
Good morning.
And joining us here in studio is lawyer Alex Van Kralingen. He represents 5 people who are either family or close loved ones of seniors who were killed by Elizabeth Wettlaufer. Thank you so much for being here.
Good morning.
And you're going to be with us for the next couple of hours, so we do appreciate that. And Alex, I want to start with you because you were in the lockup yesterday to get a first glance at that report. I'd like to get your overall impressions.
Well, my clients generally were very pleased with the report. We think it's both ambitious but also has tangible goals that government can kind of wrap their hands around and move forward with. In particular, you've highlighted areas that we are very happy that the Commissioner made recommendations on. The first one is increasing staffing on floors. In her report, she noted how spread thin frontline workers are in long-term care homes in Ontario. And so the conversation about increasing both registered staff, registered nurses, but also the idea of increasing pharmaceutical staff was welcome. And second, the idea of investing infrastructure money into medication management systems in the homes was greatly appreciated by my clients.
Okay, so we are going to get into some of those issues in our discussion right now. Laura, I will start with you on this topic because we'd like to focus this hour on what people should look out for as they consider placing a loved one in a long-term care facility. And I want to ask you what you think you should watch out for. What questions should you be asking for? What criteria should you be looking at before actually placing a loved one in a long-term care facility?
Building on Alex's point, staffing is critical. Often people will go into a long-term care home and judge it based on the carpet or the color of the walls. And while that may be important, some people really what it comes down to is what is the quality of care and what is the quality of life. So ask hard questions. Ask about how many staff they have on, but not just Monday to Friday, 9 to 5. Ask them about what happens in the evenings, weekends, and holidays when staffing is often very short. And ask not just about how much staffing, but what the qualifications of the staff are. In Ontario, for instance, you only technically need 1 registered nurse per long-term care facility. Certainly higher standards would be preferable.
All right, some very good points there. Alex, do you have something to add?
The only thing I would say is that the Long-Term Care Homes Act in Ontario, and I assume there are comparable regimes in other provinces, have online listings of every time a home has a moment of non-compliance, a public reporting database, for lack of a better word. And to add on to what Laura suggested, I'm going to suggest that family members who are contemplating putting a family member of theirs in long-term care actually spend some time on the public reporting database, identify the homes that you're interested in, and then see, do they have a history of non-compliance with the Act? If they do, perhaps that would be a red flag. If they don't really have any much of a history, that presumably would be comforting.
Now, we've talked a lot about ratios, staff to resident, and Laura touched on it as well for nursing homes. How does your average person determine whether there's a healthy ratio at a facility that they might be visiting? How do you know if there are enough nurses on staff? Is it as simple as a question?
It undoubtedly is a challenge, I'll say that. But first thing I will say is you got to visit the facility and go with your gut. If you feel, particularly during a day shift when you visit, that people seem to be getting appropriate care, that's comforting. We've heard many stories, though, where there are older people living in these homes who, quite frankly, are just waiting forever for help from a PSW or a registered nurse. Those sorts of things, I think, can be actually seen when you visit the home.
And Laura, what determines a healthy ratio?
Well, really, the challenge is that when we created long-term care homes, we weren't actually creating them for the level of acuity and fragility of the people who now live there. So as a result, what we need to be asking is, what's the types of care available at different levels? So if there's a dementia care unit, the care needs are different, higher, than they would be if they were a person who was residing in long-term care because perhaps of physical frailty. So asking about the different kinds of levels of care and the staffing at each level of care is critically important. And I always recommend that people actually go to the homes and spend some time there. And often people don't. They go in, they look around, they put the name on the list. But what they should do is talk to the residents, talk to other family members who are visiting, eat the food in the actual cafeterias or restaurants, and just see what the environment is like. That can be a very helpful indicator.
If I could just add to that, residents within the home themselves can be resources. In Ontario, each home is mandated to have what is called a residence council. That council is statutorily bound to meet with the administration of a home to talk about quality of life issues across the board. And so if you can find out who the members of the residence council in any given home are, spend some time with them, because they would have a unique perspective into both the benefits and the challenges of any given living environment.
It must be so difficult when you are looking for a place for your loved one. Laura, are there agencies to help you sort of navigate one home to the next, to the next, to the next? Because, as you say, visit them, spend some time there, but that takes time.
It really can be a great challenge. Each province and territory has its own system for admitting people into qualification for the long-term care system. So you're going to go in generally through some type of public health agency. In Ontario, it would be through the LHIN. And other jurisdictions, it's going to be through the local health authority. But once you're there, trying to navigate it by yourself when you may have a busy life can be enormously challenging. And we're seeing a new industry start up of consultants to help concierge you through the process and do some of that research for you, particularly since many family members and friends who are supporting the older person needing care can be kilometers, hundreds of kilometers, or provinces away. So we're seeing a private pay system of consultants starting to rise.
Now, Alex touched on checking out a facility online for its history. Do you have anything to add about that, about looking into a facility's history?
In other jurisdictions, there are similar types of registries, and that can be very helpful. You may also look online at the ombudsman of your jurisdiction, or you may have a seniors advocate in your province, like British Columbia does, who's done a lot of research on it. And they have very, very helpful information on their websites. But in the end, a combination of looking at the public information and really going there and talking to people can be enormously helpful. Not only in Ontario do we have residence councils, but we also have family councils, and Ontario is the only province that has that mandated in legislation. And so that is an organization, a voluntary organization of family members and supporters. And they often have got the real goods. They can give you information about what the administration is like, what the pros and cons are, and what some of the hidden issues are at that home. I recommend asking for the information of the residence council and the family council where that's possible.
Now, we received a few comments from our audience about the use of cameras within long-term care homes to help keep loved ones safe. And a question from our audience from Timothy Sherry Ayler via CBC News YouTube asks, how do you use cameras appropriately when you're addressing intimate personal activities of daily life? Alex, what can you tell me from a legal perspective?
So from a legal perspective, it can go on a jurisdiction by jurisdiction basis. My understanding is that in Quebec, last year they expressly passed a law allowing for residents of long-term care facilities to essentially put a nanny cam or videotape the particular resident who the family is concerned about without informing the home. Everywhere else, from my understanding, there are no specific regulations, and so you get into a moment where it's just a simple one-party consent about videoing. a few challenges with that. The first one is that many residents of long-term care facilities live in shared rooms. And so you've got to make sure that the video is trained on the person who you want to watch, but also that you get some sort of technology that won't inadvertently capture voices of others, particularly where that resident is out of the room. In terms of capturing those intimate moments, I think it is a challenge. But if it's the person who everyone is trying to get on camera, presumably that is not as much of a concern. Finally, the last issue is what happens when you've got someone who can't make their own decisions. They're incapacitated. There's an open question, I think, as to whether you can, a power of attorney can put on a camera of that sort. I think the better answer to that is yes, but it certainly is an open question at law.
Yeah, and I think in the case of Quebec as well, if you are sharing a room, you do have to tell your roommate that you will have a camera in the room, even if it's not trained on that person, as far as I understand. And Laura, do you have anything to add to the camera angle?
It is important to remember that so much of the challenges that we're worried about in terms of abuse or neglect also can happen in the bathroom. And that's also one of sort of the more intimate areas to have cameras in. Certainly if it was in a bedroom and in a private room, I think generally people are moving towards the idea of cameras in the room, perhaps cameras that don't have sound recording so you don't accidentally pick up something else, as a very safe area. The concern is, what do you do about toileting? What do you do about bathing, where some of the big concerns are? I think people are more conservative about that. They're less likely to want cameras in bathrooms. And so that is an area where you really need to be doing some probing, particularly since one of the areas of neglect that we see time and time again are people who are not being taken to the bathroom appropriately or who are not being bathed appropriately. So we have some work to do around how to ensure safety in a bathroom.
Judy Hamilton from North Bay wrote in saying this. She says her brother currently resides in one of these facilities in North Bay and has been assaulted by other residents on more than one occasion. She says she always reports to the medical staff and they say they are following through with their investigation. But what else can she do in these situations? What recourses do people have? What kind of follow-up should happen here? What recourse do you have if you suspect abuse or have issues? So why don't we start with you?
So under Ontario's Long-Term Care Homes Act, there's a robust resident bill of rights, but also there's a reporting mechanism to the ministry. That reporting mechanism is separated into urgent matters such as abuse and non-urgent matters, the quality of the food, the temperature of the home. In circumstances of an urgent issue, the Long-Term Care Homes Act has a hotline that you can call. Separately, there are ways to get in contact with the ministry. You can contact them on an anonymous basis, or you can contact them with your name. If you do contact them with your name, their service standard says they'll get back to you within a few business days. And so that prompts a process. If for any reason a resident is uncomfortable with the way the ministry's inspectors have managed the situation, ultimately there is a patient ombudsman in Ontario who you can go to essentially provide oversight of the ministry's responsibilities. Separately, for registered staff like nurses, they've got their own Regulated Health Professionals Act. They've got their College of Nurses, and complaints could be made there as well.
And if we're talking about across the country, you mentioned ombudsman that you can go to. Would that be in other parts of the country as well?
My sense is that there is a patient ombudsman for most jurisdictions across Canada.
All right. And Laura, what would you say in this situation?
Those are the right processes, of course, but for family members who are struggling with somebody who's been hit or is afraid or is dealing with abuse, either from another resident or from a staff member, those processes can seem long and they can seem not really addressing their unique situation in many cases. So there's some practical steps that you can take on an immediate basis. First, ask to speak to the director of care personally. Have a sit down and explain in detail what the incident is and what the concerns are. If it has to do with another resident, you have to decide whether that resident was acting out because perhaps they were having a behavioral response to Alzheimer's, or was this a case where they were actually intentionally harming someone? It's different. But for the person who has a loved one being hit, it doesn't feel very different. Talk about what other options are available. Can they be separated? Are there ways that you can have increased monitoring? Is there something that you may install, like a camera, to help you? And are there people who can sit by the bedside with that person, maybe for the next 48 hours?
Is there a good way and a bad way to lodge a complaint, Alex?
Well, first of all, in terms of the evidence that you would collect in connection with a complaint, the best evidence is contemporaneous evidence, evidence that is taken at the time. And although it can be difficult, particularly in situations of abuse, if you can have as much physical evidence as possible, pictures, any audio recording, any video recording, as Laura was speaking about, that's obviously very helpful. The other way to do it is to be as factual as possible, almost dispassionate in your approach. These are family members who we all love, but the more factual you approach the complaint, I think the easier it will be for inspectors to be able to assess the validity of the complaint.
The question from Dot Slowick, and she writes, long-term care workers become desensitized to the fact that they are to be caring for human beings instead of become an act of processing as opposed to caring. Do you think smaller facilities rather than larger institutional style facilities would benefit both workers and residents? Laura, I'm going to put this first question to you.
This really speaks to the need we have for both staffing, but also a transformation of culture in long-term care. Many of your viewers may have heard of the butterfly effect or the Eden alternative, and those recommend smaller type nursing homes that work on an empathy basis. So it's less institutional, people are not wearing uniforms, and it really is about making sure that the resident has the quality of life that they want, that they're actively engaged. And what we see out of those types of philosophies in long-term care home is that the staff do not get desensitized, that they actually are active and engaged and have better report of their working environment. So we really need to see a transformation in how we do long-term care, and it's started.
All right, let's get to another question. Linda Chandler wrote us some disturbing stories about a death in a long-term care facility. She asks, what is being done to address this dangerous practice of allowing violent residents who may be suffering from dementia free access to other residents who may be seriously harmed or murdered? Alex?
So security in long-term care homes is not only something that's flowed from, the conversation's not only flowed from the Wettlaufer inquiry. In fact, there have been past coroner's inquests in Ontario where people who have had dementia have committed violence against other residents. And so there is a broad spectrum of recommendations that have been made their way into these long-term care homes. In certain cases, there are secured facilities for people, secured portions of the facility, for people who are dealing with dementia. But also there is training that is given to long-term care frontline staff on how to manage these situations. Candidly, it's not perfect. And again, if a family member is found to have had violence committed against them by some other resident for whatever reason, all of those regulatory steps that we talked about in our last conversation would apply. You can contact the ministry and you can contact the patient ombudsman if you're not comfortable with what the ministry's done.
Okay. Rebecca Santos wrote us via email. She says her mom stayed in care for 12 years, and she says nursing homes have very few registered nurses. They mostly have registered practical nurses. Though they may be certified in administering medications, their knowledge and skills are insufficient regarding medication administration. Their nursing assessment skill is not sufficient as well. So, Laura, how true is this, and how concerning is it?
Now, the question really speaks to the constant downloading on expertise that we've been seeing in the long-term care system. So back in the day, we would see doctors in long-term care. Now it's a rarity to actually have a resident doctor there. And we used to see a lot of nurses, RNs. Now you may only see one nurse per long-term care facility. We see this downloading to licensed practical nurses, and even farther, down to personal support workers. And personal support workers are generally not regulated across this country and may have had very little training. It doesn't mean that they're not compassionate, good people doing hard work. But what the caller is speaking about is the lack of expertise that we've seen in long-term care as a continuing flow. And what we need to do is bring it back up again.
And Alex, you want to jump in here
Yeah,
too,
and that's
right?
one of the things that the Wettlaufer's inquiry's report has prompted is a conversation about, through the policy recommendations, about more registered staff on the floors, but also dedicated staff with pharmaceutical training, pharmacists and pharmacy technicians, to assist with some of the medication management issues that have been prompted by the question there.
Okay, let's move on to another question. This one is from Sheila Baslaw, who asks, who is policing the nurses? Why was she hired over and over again in spite of being fired over and over again? Alex, can you answer that question?
So the question of who polices the nurses, it's the regulatory college in any given province. So in Ontario, it's the College of Nurses of Ontario. The question of why she was hired over and over again is actually a complex question. There are huge labor market shortages for registered staff, particularly in smaller communities like the communities in Southwest Ontario that were touched by Ms. Wettlaufer's crimes. And so at the inquiry, every single person involved in hiring said that the hiring of nurses was an urgent matter. And so one of the things that we have said is that if we don't have a labor market that can meet the needs, it doesn't matter how much money you throw at it. There simply aren't going to be enough nurses to hire. And nurses who are not as high quality may be hired simply because there are consequences of not having anyone at the home at the time.
Joanne Knudsen, who says, senior care is now a multi-billion-dollar business. It seems no one is answerable anymore. I never thought I would live to see the day that even though we as registered staff warned the powers that be, no one listened because the main concern was the almighty dollar. And Alex, how do you respond to that?
Well, undoubtedly the private sector of long-term care is significant. Where government has the ability to regulate, it should, and where government has the ability to set what funding envelope should be used for, it should. And I can tell you that as part of the report, there have been express conversations and policy recommendations about expanding nursing and personal care envelopes and better clarifying what certain envelopes can be used for, not just being taken as profit.
Okay, and Laura?
We see time and time again people being told that they need to provide their own personal products like adult diapers or their own other types of products that would ordinarily be included in long-term care because it's being downloaded onto the private individual. There's been real challenges about that. We've seen cases where people may only be changed twice a day. And why? It's a combination of staffing and keeping costs low. We need to rethink this model. And we've seen in the US, where the private care home system is very, very robust, that they have enormous problems balancing out quality of care with this notion of profit. And that's our thing that we really need to address in Canada front on.
Robert Barker asks, many seniors who are in long-term care have no family members, so if they experience any type of abuse, who are they supposed to complain to? They may have no one to sit by their side to comfort them. Laura, let's start with you.
It's even harder where that person may have some type of cognitive impairment or dementia. And we're really seeing the rise of what we call elder orphans, people who have absolutely no one. Now, in each province and territory across this country, we have public guardians and trustees. Those systems are often very stressed, but they are the ultimate person who would take care if there's no other one to do it. But what we see time and time again in long-term care is these people can be quite abandoned. What we hope, of course, is that the long-term care facility will identify these people and make sure that they're eligible and engaged with visiting programs, volunteer programs, connections through things like the Alzheimer Society or other caregiving coalitions, and that family councils in Ontario are able to ensure that they have connection and visitation. In practice, it doesn't always happen.
Do you want to weigh in, Alex?
I would endorse that answer entirely. It's a really challenging problem. The only other resource I would suggest within a home is, again, the residence council, mandated by law. People who have to engage with the administrators of a home, they may be able to help mediate or manage problems for a senior in this moment.
All right. Here's a question now from Don Smith, who asks, here in Ontario, there are no requirements beyond the first level of certification for PSWs, personal support workers, to service dementia, Alzheimer's patients, to my knowledge. What's the opinion on special training for PSWs that care for dementia, Alzheimer's patients? Alex, what do you think?
Well, two things. First of all, the federal government, as you know, has recently released an entire dementia strategy for across the country with investment in these issues. Secondly, the inquiry itself expressly talked about the creation of a separate department within the Ministry of Long-Term Care that is dedicated to education and training. And so not just with respect to questions of healthcare practitioner who's trying to intentionally harm somebody, but this education and training could absolutely assist with better training of all staff, including PSWs, for dealing with dementia. So I think it's valuable to be doing it, and I actually think we have a path after the inquiry's report to get there.
And Laura, would you like to add something on this question?
What we want to avoid doing is what we call blaming and training, which is to blame the people at the very bottom level of the pyramid, which in this case is often personal support workers, and do a one-time training. What this report has indicated is we need an entire systemic shift. And what's important as well is to realize that working with people with dementia requires a certain skill set. And right now, they may not have that skill set. So for instance, some of the what's known as abuse or aggression of people who have dementia may actually just be responses to being afraid and not having somebody let themselves be aware that a person is behind you. And so there are very specific techniques that you can do which can reduce the strain and stress. And some people compare it to autism training. If you know how to approach a person with dementia and enrich their lives, they become less stressed. And indeed, violence and aggression is reduced. So it's important not just for the quality of care, but it's also important for the safety of staff.
Okay, I want to get through as many questions as we can this morning because we're certainly getting a lot of them. And Oscar Lopez says, the level of care and attention in both hospitals and long-term care facilities is scary during the weekend or holidays and even evenings. There should be rules and regulations to make sure these low nurse and doctor attending hours are properly staffed. Also, more spontaneous inspections of long-term facilities must be enacted. Alex.
So the Galeese report yesterday spoke to a few of those issues. First of all, recognizing that staffing levels have been very low, that people are stretched thin, and that this issue has been on the public radar for about 20 years at least. What the report is suggesting is that the government undertake a study to determine what is the safe number of registered staff to be on the floor. Not just whether one person is enough, but rather what would allow us to feel confident that residents are living in a safe environment. So there's a conversation about investment there, but it's absolutely a concern. There's no reason why a long-term care home can't put more staff on. So the question of the current regulation is actually, it's not quantitative, it's qualitative. Essentially saying, do you have enough staff to meet the needs of patients? And that's how long-term care homes have been able to get away with, in these overnight shifts, having only one nurse for as many as 99 residents in Ms. Wettlaufer's case. And so the inquiry report has expressly tried to attack that issue. And the government yesterday said that they're going to take it seriously, including monetary investment in the system. So we're hopeful that that means an investment in frontline care.
Okay, we have time for one more question. And Jocelyn responded to some of our earlier discussions, saying that you suggested it's important to tour places and ask tough questions about ratios. But she asks, how is that possible when ministry standards dictate what the ratio is? How can one find LTCs that offer higher ratios than the ministry standards? Laura, over to you.
This person should probably look for a model of care, something like the butterfly model, the Eden alternative model, the greenhouse model. If you get to know that language, you can look for long-term care facilities that have adopted that philosophy. There's been very successful versions in Peel. We see 2 dementia villages now, like we had in Holland, just opened this year in Canada. And we're seeing that actually the municipality of Toronto has endorsed to change all of their 11 municipal care facilities over to one of these transformative models of care. So it is difficult to try to find out just by going in and saying, what's your staffing levels? But if you can get a sense of the philosophy behind it, the staffing levels follow the philosophy.
Okay, Alex, I'm going to give you the last word today.
I was just going to suggest, just to add on to that, I recognize it's a very difficult process to try and put a family member in long-term care, in a long-term care facility. When you're speaking to people, just don't speak to the facility itself. Speak to the people who are residents there, who can speak to the lived experience. And I think that'll put you in a best position to find the best place for your loved one.
Gotta say, thank you so much for spending so much time with us and for your insights. I've learned so much today, and I'm sure you've answered a lot of questions for Canadians coast to coast today. Thank you so much.
Thank you.